I remember growing up in the northern part of Zambia, where we have lots of lakes and rivers. And therefore malaria there was extremely common. And no child grew up without having been hospitalized a couple times. A mosquito bite is all it takes for malaria to spread.
So Partners for Malaria-Free Zambia is just a really exciting step forward in the fight against malaria.
From Rotary International to Gates Foundation to World Vision, PATH, as well as Malaria Partners International.
Partnering closely with the Ministry of Health to support their vision of a malaria-free Zambia.
And because of Rotary being present, across the country, it becomes a very effective vehicle for this particular program.
The short-term goals basically is to ensure that severe cases and deaths are reduced in Zambia, but the longer goal is to eradicate malaria completely from Zambia.
Many of these communities are 5, 10, 15 kilometers away from a rural health facility.
And so I think one of the major successes has just been being able to make sure that we have community health workers that have the supplies that they need and are deployed in areas where they're needed most.
Community health workers are volunteers, and they are named by their community. They are the last kilometer health care for 1.25 million people in Zambia.
Ndapima abantu malaria nga bandetera omulwere namona ifyale moneka pantwaire sambirira kulya malaria ikalamba na malaria inono ifishibiro fya malaria ikalamba ne fishibiro fya malaria inono.
Ubulwere bwa malaria bwalinyingira sana mu Lupwa kuchakumwenako napapita emyaka mupepi na 20 kufumapo nalufishepo omwana wa first umo wa number 6 twalifire okuya ku clinic omulandi wakuti pali apatali pali almost 9 kilometers kufumpa famu okuyafika pali clinic.
So ifanga ba community health worker to making sure to funda abantu awudi obulere bwa malaria nokuba ububi bwaba mukana sanku kana yako mukupimisha obulere bwa malaria.
The community health worker will follow the member of the community at his household, who will test every member of that community, and they will record in an active register. Once they do that, they will now report directly in the district health information system for the Ministry of Health.
Chila tusansa musha sana nga nikulu balirwandi mbeta sha sana she umulandu ngata kuli aba bomfi bafya abumi kuno kumichinde kumyeso ulwere bwa malaria bwenda kunanga nabu tuchimfya nombo mulandu wakutina tukwata abomfi bafya abumi baletu wafa sana bale bomba bwino sana.
When I look at the way Rotarians came on board in the fight against polio, I'm well convinced that Rotarians are the best place to help in the eradication of malaria.
I think from here on, we're going to see a lot of things happening. We're going to see a lot of impact in the communities. But I want to assure you that the Rotarians of Zambia are equal to the task and want to see this program successfully through.
I think this is exciting, that we can create change, not only in ourselves, but even in the communities where we collaborate and work together. So there's a lot to learn from that as Rotarians, as we scale up and create greater impact.